In this video, we're going to look at some of the things that we can look at if we did an electrolyte panel, which is typically done through blood, and looking at some characteristics in a urinalysis, which would be testing your urine for some of the same types of electrolytes. So when we're looking at electrolytes, we can either test for their presence using blood plasma, or we can test some of them using basically a simple dipstick test that measures those substances in your urinalysis. So these are the different tests. As we go through them, you should be filling them out on the attached worksheet as we look at the specific patients. But first of all, let's talk a little bit about osmolality. This refers to the number of individual solute particles that are dissolved in a kilogram of water. It has no concern with the identity of the solute, so we don't care if it's sodium or chloride or potassium. We just are concerned with how many of them. Because remember, if there are a lot of solutes in our fluid, that means that there's less water, okay? Because there's more solutes that are taking place. So we report osmolality as milliosmoles per kilogram of water. And then we test the extracellular fluid for osmolality, and a normal range is going to be 285 to 300 milliosmoles per kilogram of water. Now, why is this number important? Well, because if you have a low osmolality, that basically means that you have an inadequate number of solutes. You don't have enough sodium, you don't have enough chlorine, you don't have enough potassium, all of those different electrolytes. You do not have enough of those, which vice versa means you have fluid overload. So fluid overload could be from drinking too much fluid, or it could be from the shifting of fluids in the different compartments. But typically water shifts from your extracellular fluid to your intracellular fluid in cases of low osmolality. And as the water shifts into the cells are obviously going to fill up with water then. They're going to start to swell, and it can actually cause the cells to explode, which is called lysis. And if cells are exploding, then they can't do the things that we need them to do to keep us alive and well. So typically a low osmolality will be caused by excessive fluid intake, so drinking way too much water. So we don't want to be dehydrated, but we don't want to drink too much water as well. It can be caused from vomiting and diarrhea, also sweating, and these cases when we're losing a lot of electrolytes when we vomit, when we have diarrhea, when we sweat, and when we replace it with, let's say, water, but we're not replacing the electrolytes. That can cause a low osmolality. So that's why something like Pedialyte, you give Pedialyte to kids who are sick to their stomach or are vomiting a lot or have diarrhea, because we don't want to just replace the water. We need to replace those electrolytes as well. If you have a high osmolality, that means that you have an elevated number of solutes, so sodium, potassium, chloride, or you're dehydrated and inadequate body water. So in this case, water will move from inside of the cells, the intracellular fluid, to the outside of the cells, the extracellular fluid. And as water pulls out of the cells, it causes the cell to shrink, and we call this crenate. And this is going to be caused by dehydration. It can also be caused by vomiting, blood loss, and fluid loss from burns. So anytime that we have a large amount of fluid loss, we're going to end up with a high osmolality number. So looking at specific compounds then, we'll start with potassium. So hyper in any case means there's too much of it. Hypo means there's too little. So potassium moves through the different fluid compartments. So the interstitial fluid, the blood plasma, the intracellular fluid, via diffusion and active transport. Sometimes we have to use the active transport pumps like the sodium-potassium pump to pump sodiums back across into a different compartment. It's measured in milliequivalents per liter. A normal value is 3.5 to 5.5. So if you have below 3.5, it's called hypokalemia. And if you have above 5.5, it's called hyperkalemia. And both of these are bad because they're going to affect the resting membrane potentials of our nervous, nice typo there, right? And cardiac muscle cells. So remember, our neurons move along and cause contraction because potassium moves across the membrane. So if we have inadequate numbers of the potassium, it's going to disrupt our ability to have an action potential or an impulse travel. Sodium also moves through the fluid compartments through simple diffusion and active transport. Again, in the sodium-potassium pump, we have to input energy to pump things across. It's also measured in milliequivalents per liter. Normal values are 135 to 145 within the extracellular fluid. Hyponatremia is low sodium levels. Hypernatremia is high. And again, remember, water levels are going to be opposite of sodium levels. So if you have low sodium, you're going to have high water. Both hyper and hypo will affect fluid movement across the plasma membrane. So osmosis will be disrupted because of the levels of sodium. Calcium moves through the compartment via diffusion and active transport, measured in milliequivalents per liter. Normal values 4.5 to 5.2. Hypocalcemia is low, and this is going to increase or cause our bodies to basically pull or reabsorb calcium out of our bones into the interstitial fluids. And high is hypercalcemia. Both of these situations are going to disrupt our muscles' ability to contract. So remember when we talked about the sliding filament theory and the role calcium played with that, if you have too little or too much of it, then muscle contractions are going to not function the way that they should. Chloride, Cl. Typically, we don't look at this level very often. We would look more at sodium because they're usually combined, but we can get values of them. Normal value is 95 to 105 milliequivalents per liter. If you are low, it's hypochloremia. If you're high, you have hyperchloremia. The biggest concern would be in a situation of hypochloremia. Again, that's going to cause calcium to be pulled out of your bones. And also affect activities in the nephron. So your urinalysis data table gives you 3 patients, patients X, Y, and Z. And we're going to go over some of the results of their urinalysis as you fill it in, and then you're going to analyze their particular results. So when we look at urine, we look at physical properties first. So what is the color? Is it a normal yellow strawish color? If it's very light, that might indicate that we have too much water. So it might indicate that we have diluted our urine. This can be caused from just drinking too much water. It can also be caused by a situation called diabetes insipidus, which you learned about in the case study. If your urine is very dark yellow or orangish, that can indicate dehydration, so not enough water in your urine, or it can also indicate the presence of certain substances. We want our urine to be clear. You should be able to see through it. So any kind of cloudy urine can indicate a couple different things. Maybe that there are white blood cells in there, so signs of an infection. There might be fats, proteins, or also bacteria that makes the urine cloudy. Odor, it should not really have an odor. If you have a very ammonia type of odor in your urine, that can indicate a bacterial infection. If you have a very sweet odor, almost like apple juice, that means that you have ketones present, which is ketones are made when your body has to resort to breaking down fat for its energy because the glucose levels are not right. And then we also look at specific gravity, which is basically the concentration of things in your urine. So the different chemicals, the electrolytes, that type of stuff. So if it's high or low, that can indicate that the kidneys are not concentrating that urine properly. They're not putting it in or taking out the right amount of urine. So looking at control is what should be normal. Here's patient X, Y, and Z. I want you to look at and fill out the diagrams, looking to see is the color normal. So control will always be the normal. And what it might indicate if you think the color is not, and then also clarity. Can you see through the bottom? So you can pause this, record your results in the data table. Next, we're going to look at pH. pH is normally a slightly acidic for urine, but it can range anywhere from 4.5 to 7.5. We are going to measure this using a dipstick. Most of the urinalysis tests, all we got to do is stick a dipstick that has pads on it that will measure these different types of compounds that we're going to talk about, and then we look for a basic color change. Urinalysis are affected, or pH can be affected by food. If we eat a lot of meat, typically we'll have a more acidic urine. If we eat a lot of vegetables, we'll have a more alkaline pH or urine. High pH, so alkaline pH, basic pH, can be indicative of a bacterial infection. Acidic pH can be indicative of diabetes mellitus. So here are your dipstick tests. So these are the colors that you want to compare it to. This is the control, so this is normal, ideal pH. Here's patient X. So figure out where they would fit on the scale, patient Y, where they would fit on the scale, and patient Z, where would they fit on that scale. Fill in your data table. Next, proteins. There should be little or no proteins, again, measured with the dipstick. Remember, in the glomerulus, we do not pull proteins out. So proteins are never filtered out of the blood. So we should not see any proteins in our urine. So the presence of protein can indicate that your glomerulus has been damaged because for whatever reason, it's allowing proteins to be in the filtrate. This can be caused by high-term or long-term high blood pressure, untreated diabetes, different kinds of autoimmune diseases, or bacterial infections. Here is the urinalysis dipstick test. So here are the levels you want to compare to. The control is considered normal, no protein. This is patient X, patient Y, patient Z. So again, pause the video, fill out your data table. Looking at glucose. Glucose is not usually found because if you remember to the urine formation activity, almost 100% of glucose gets reabsorbed in the proximal convoluted tubule. So we don't want to see any kind of glucose in the urine at the end of the collecting duct. So if we do have high levels of urine, that can indicate that there's been kidney damage, or it can indicate diabetes mellitus. It's also measured by dipsticks. So here's your dipstick glucose test. We would put it in, let it sit for 60 seconds, and then pull it out. Control is going to be normal. Here's patient X, patient Y, patient Z. Fill in your data table. Ketones, normally not found in urine. Again, it can be measured with the dipstick. It is formed during fat metabolism. So when your body doesn't have enough carbohydrates and it has to start resorting to breaking down fats for energy, we're going to get ketones in our urine. So if you have a high level of ketones, it can be a sign of a starvation because your body basically is resorting to breaking down the fat because it doesn't have any other energy source. It can be a sign of diabetes. It happens during pregnancy, and we can also find ketones in our urine after very strenuous exercise. Ketones release a really sweet smell, so if you have a sweet smelling urine, that's also going to be an indication that there are ketones. So again, using the dipstick test, this is the levels of ketones. Here's the control, patient X, patient Y, patient Z. So you would write down where they would fit on your data table. Calcium, generally present in a very small amount, if any. We can actually observe this a little bit easier if we look at calcium under a microscope because you'll actually see crystals in the urine. If you have crystals in the urine or high levels of calcium using a dipstick test, that can be a sign that your parathyroid is not working correctly or it's overly working. It can indicate a bone disorder or a kidney disease. Blood is not usually present in your urine. If you do have blood, that can indicate liver or kidney disease, infection, or kidney stones. Bilirubin is also a product of your blood or your hemoglobin that's attached to the blood cells breaking down. It should not be present in urine. If it is, then that can indicate a liver disorder, cirrhosis, gallstones, or something that's causing the bile ducts to be blocked. Also can be found in people who are anemic. So here is the blood bilirubin dipstick test. Okay, so again, control patient X, patient Y, patient Z. Figure out how much blood that they would then have present. So for this one, you can kind of see if it's negative, you wouldn't come down here. If it's one of these two, then you would compare kind of colors. And then nitrates. Nitrates are produced during food metabolism, but certain bacteria can also reduce nitrates to nitrites that are found in the bladder or the urinary tract. So it can be a sign that there is infection occurring if you have high levels of nitrites. So what you're going to do now is you are going to look at the data that you just collected on the patients. You're going to answer the questions on the data table about each patient, and then you are going to submit it. Have a great day.